Hello, friends. I hope this finds you well today. This morning, I'm going to talk about the frustration of e-check-in. If you have a electronic chart that lets you check in with your medical appointments for clinics, then you know what I'm talking about. Or actually, it's probably no different than the paper ones that you sit there filling out for 15, 20 minutes before you go in, but I don't do that anymore because I use e-check-in. Well, the um, idea of talking about that on here came to me because this morning I was checking in for an appointment, and the frustrations with that is what came up because one, I hate having to fill out all these questions because in the past they never even read them. They don't read them. They don't bring them up. Why did I have to answer 50 questions when nobody even looks at them? It's like such a waste of my time. Why do they make you do that? And so I had gotten to a point where I got kind of lazy and didn't really care how I answered them because nobody's going to read it anyway. But in the last year, a few times they have actually read them and then asked me about them. And I'm like, oh, goodness. And things. So now I'm trying to be more honest with limits. You shouldn't be dishonest with your doctor. At least I believe that, but not always in practice. I am not always honest with my doctors because I am somewhat fed up with doctors and Western medicine and the futility of all that stuff. And um, don't want to deal with certain aspects of it anymore. So I don't necessarily tell everything, or I color it, so to speak. So the form asked all these symptoms. Do you have this symptom, that symptom, yada 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 yada. Well, like under general symptoms, it would ask things like dizziness, or I can't even remember any of them except the one I do have, fatigue. And the thing is, if you answer yes on some of these symptoms, they're going to start thinking you have something and maybe want to do some tests, make you have more appointments. And I hate appointments. I don't like going to appointments. I don't like taking tests. It never finds anything anyway. It's a waste of time and stuff. But I do have bad insomnia. I've had 2 good nights sleep in about 4 or 5 years. And it's extremely frustrating. I'm very exhausted all the time, have fatigue. I just have no energy. So, yeah, I have fatigue. And another one, a couple others I had to answer because I've been having what I call edema, is because I've been having swollen ankles and calves. And now also my hands have started swelling. And they do say go to your doctor and make sure nothing serious is wrong with you. Well, I don't have other symptoms. I just have swelling and a lot of discomfort and pain. I do have a lot of discomfort and pain, but I did have a heavy weight gain last winter that I'm working on losing back. I've been morbidly obese my whole adult life. Most of the time, I have gotten my weight down a couple times, but this time it seemed to push me over the top as far as having edema and painful swelling. What I think is causing it, I don't know if a doctor would even pay attention to that. I don't know. It'll be too lengthy for me to go into it right now. But the thing is, I have not seen my doctor for the edema. And the doctor I'm seeing, that I'm filling this check-in out, would not be seeing me for edema. So I don't even know why they're asking these stupid questions. So I was like, well, do I say my legs are swollen? Because it's asking, are your limbs swollen? Joints swollen, this swollen, that. Yeah, I'm a fat woman, and I had a knee replacement 4 months ago that I'm still having bad problems with, and swelling and pain. And I got swollen. It's like I'm a 242-pound woman who feels like she's dragging 600 pounds around, or maybe 1,000, because it's like my legs feel like huge sandbags that I'm trying to haul around and stuff. But it was frustrating because it's like, well, if I start saying this, what if she does ask, and then she's going to be like, well, have you talked to your doctor? And I'll be like, no, I have not. And things like that. Or do you have, I can't remember. Of course, I was just saying no to everything because before I would answer them with, in my head, I'd go, well, not lately, or I know why I have it, so I don't need to put it because I'm not having more than I usually. It's normal for me to have like the mental health section. That was really fun. I think I had a yes on everything except two of them because it was, trouble sleeping, depression, anxiety, stress. Yeah, I got all those things. It's normal for me to have all those things. I suffer from acute depression. I'm a certain degree of depressed all the time. And it is December. It is dead, dead months of the year that I have seasonal affective disorder really bad. So yeah, I don't do well this time of year. So if it would be odd if I wasn't depressed or having certain symptoms, I'm handling it best I can, and there's nothing any doctor is going to do about it because they haven't and they can't because they just want to pump you full of drugs, and that's not going to do it either. So anyway, yeah. So and I know what I need to do to handle my depression and anxiety and stuff like that. I know the tricks and the um, things to do to make it better, and I know how to take care of myself, and I know all that stuff. And so I don't want some doctor trying to that's not. I have a psychiatric provider that does my medications, and I have a therapist. I don't need some other doctor going, what's this all about? It's not your business, in my opinion. So that was the frustration with the form, because that one had that and some other things, and I was like, well, and then like the gastrointestinal section was kind of full of yeses too, because I have a lot of trouble with acid reflux. I was diagnosed with gastroparesis. I'm not 100% sure I actually have that. I think I know what was causing the problem more, but you can't tell doctors anything because they're the ones who have the answers, or don't have the answers, but they don't listen to your answers. Anyway, so that was my frustration, was I didn't want to say yes on this thing and have, if the doctor actually read it and started asking and wanting to do something about it. I don't want her to do something about it. Just do what I'm here to see you about. Let's, just do that. And then I'll see my other doctors for the other things, is my opinion. So that's my frustration with those forms, is to be honest or don't be honest. Because if you just say no to everything, nothing happens, and that's good. If you say yes to things, 9 times out of 10, nothing happens because nobody reads it. But like I said, in the last year, people have started reading them and asking you about them. And so then it's like, oh, then you got to deal with it. And, or they'll want to deal with it. Maybe not. They might accept, oh, I have a doctor taking care of that. That's just, I have insomnia. That's why I have fatigue, that kind of thing. So maybe you've experienced the same frustration as, do I be honest on this form and say yes when that's a yes, or do I leave it a no? Because what are you hoping to achieve? All I'm trying to achieve is to see this doctor for what I'm seeing her for, and have what I'm seeing her for be treated. I don't want to have her go, well, maybe you need to, pressure me to see my doctor to go get to see more specialists, or, fun stuff like that. So that's my frustration with filling out the e-check-in when they include all these questions that have nothing to do with what you're going to see the doctor about. Anyway, hope you're having a great day and have a wonderful weekend. I'll see you again next time. Thank you.